I'm Daniel Levine, and this is the Bio Report. AARP, the advocacy group serving people over the age of 50, is taking steps to ensure that digital health technologies best serve its membership. The organization has embarked on an effort to test the design and functionality of digital health devices for older people and provide feedback to the marketplace. It's enlisted partners United Healthcare and Pfizer as part of its efforts. We spoke to Jeff Michalka, Director of Thought Leadership for AARP, about its efforts, how it's going about testing devices, and what it hopes to accomplish. We had some technical difficulties on this podcast that were not apparent during the interview. We've done our best to clean it up, but you will hear some static early in the recording. We apologize to our listeners and our guest, who we think you will find nonetheless quite interesting. Jeff, thanks for joining us.
It's a pleasure to be here. Thank you.
We're going to talk about AARP's recent agreements with United Health and Pfizer, as well as its Project Catalyst initiative, but I thought we could start with digital health technologies and the promise they carry, particularly for people over the age of 50. What would you say that is?
Well, I think there's a lot of different opportunities to improve the quality of life for people as they age. Our group is working with the marketplace to help stimulate and empower entrepreneurs to build better solutions to help people overcome the challenges and maximize their quality of life as they age. I think specific areas of opportunity are around things such as what we would like to call aging with vitality, which is our assistive or other sorts of devices and services that help people maintain the quality of life or even, in some cases, perform better than they did when they were younger and sort of mitigate some of the declines that happen associated with aging. I think that's an interesting area, as well as things such as medication adherence and compliance, keeping people on their drugs and their prescriptions so that they maintain a regular usage and then are able to be in compliance with their regimens and hopefully live a more healthy and better life.
And from a demographic point of view, what makes this segment particularly attractive to digital health providers? How big a market do they represent?
So in some senses, it's staggering. There are over 100 million people that are over 50 right now, and it'd be a disservice to say that they all have the same needs. There are several different segments within that, but if you take an aggregate, many of the conditions are prevalent across the whole age range from 50 up to whatever 100, 110 as we're getting to that stage in longevity now. Our estimates say that there's about $100 billion worth of revenue opportunity over the next 5 years in serving this demographic in digital health and wellness technologies. And our projections, which come from a group called Parks Associates that we've done a lot of work with in forecasting and mapping out this area, suggest that there's probably about $30 billion worth of revenue opportunity there. And the important thing is that this is an opportunity that's related to improving the quality of people's lives, keeping them healthy, happier, and more fit. And in some ways, it's an awesome challenge for people that are looking to change the world in a certain respect, in that most projections say that something along the lines of 80% of healthcare resources go towards serving people at over 50 and as they age. So there's an incredible amount of opportunity there to improve outcomes, create better efficiencies, and save the whole healthcare system a lot of money, but also do people a lot of service and making them happier and healthier.
While digital health technologies hold great promise to revolutionize healthcare and improve health, they have a long way to go to live up to that. What do you see as the big barriers right now to capturing, monitoring, and interpreting data so it has real value?
There are significant challenges. I think one is just the manner in which the healthcare system's been sort of cobbled together over the years, and how health IT has been introduced into that. There's a lot of issues in terms of adaptability and adaptability for end users to take care of themselves and to be empowered to look after their health. So there's usability issues. Price point is a huge issue too, especially as we talk about the older generations that are on fixed incomes. There's a million different gadgets out there, and if you were to cobble together a solution to keep someone in their home and keep them safe and healthy, and when you start adding up all these different elements, it can get up into the hundreds of dollars per month in terms of services and hardware. So there's a real poignant issue to try to bring down the cost point for some of these services and some of these hardware, and then the accessibility and interoperability between different systems to share data and to, in some cases, correlate it in a safe and private manner so that it can be analyzed, and then algorithms and other things can show when someone's in trouble or when someone's about to be in trouble, which would be more ideal.
Well, let's talk about Project Catalyst. Can you describe what it is and how it came about?
Sure. So Project Catalyst, which we term as the power of we, is really a culmination of about 3 or 4 years worth of work coming out of our group here at AARP and Thought Leadership. I'm trying to think of different ways to bring the user and the consumer into the conversation as different technologies, especially around health and wellness, are developed to meet their needs, so that the quality of these products when they get to market is better and more relevant and more effective for helping people live better lives. So we hold within our group a pitch day, a kind of a demo day / Shark Tank style event. We've done about to do our 4th, which will be in Miami on May 14th, where we bring health and wellness technology entrepreneurs and we put them in front of not only a panel of expert judges and venture capitalists, but also our members within our AARP Life at 50 member event, and have the opportunity for these entrepreneurs to pitch to our members in that panel, and then rate them. They're rated by those 2 audiences in real time via audience response devices. And we found that this has been an incredible opportunity for the entrepreneurs and the innovators to get real-time market feedback from their potential customers and consumers of their products and services. But unfortunately, it's a one-time event, and we're really impacting the 10 to 15 companies that we have up on stage. So what Project Catalyst hopes to do is to become a bit more scientific, a bit more regimented, but make scalable and repeatable studies that are then given out to the marketplace in a way that the insights and trends can be in consumer behaviors can be understood and then utilized by all of the marketplace at scale, so that better products can be developed and then eventually deployed into the consumers.
You're conducting your first study in conjunction with United Healthcare and Pfizer. How did that come about, and what do they bring to the effort?
So United and Pfizer are incredible supporters and collaborators on this project. What we wanted to do was gather a coalition, so to speak, of like-minded organizations that not only are interested in keeping people healthy and well, but also recognize that the tremendous social need around keeping people healthy and well, and then also have the opportunity and the power and the scope to be able to, in some cases, push along and implement some of the findings and insights that might come out of the studies. So while we started with, we're looking at categories within the ecosystem of the industry, and we're looking to bring on other types of collaborators as well. So while United Health represents our payer category and Pfizer represents the pharma industry, we're also looking to bring on provider systems, telecommunication providers, and infrastructure plays, retail pharmacy and retail, and even nonprofits, to try to build a community of folks that can really take these ideas and these insights and bring them out to the marketplace to improve the quality of life.
My guess is people designing these devices are often of a different generation than the intended end user, at least when it comes to digital technology that's designed for older users. How much of an issue is that?
It's a significant issue, I think. I tend to find that there's 2 sorts of folks that end up getting into this space right now, and one would be someone who's experienced a family issue, perhaps a mother or a grandparent or something along those lines, that's had some sort of issue and they've been pulled into the caregiving role, or have noticed a diminishment in this person's ability to function, and then design a solution to help them along. And then another group would be typically that first group, those people are smart people that are great at building things, but may not have the know-how to build sustainable businesses that can endure the test of time. And then another group would just be smart people that are looking for the next opportunity, and they get involved based on not only wanting to improve the quality of life for folks, but also the market opportunity. In either of these cases, given the nature of startups, they don't always have the access to end users so that they can design more inclusive and precise solutions for folks. So what we tend to find is people will come up with an idea and build a prototype and maybe go to their family members or friends of family and get some feedback there. But what both Project Catalyst and the Live Pitch event hope to do is to bring larger amounts of consumers together so they can voice in earlier in the innovation cycle so that the products can be better when they eventually do get to market. So there's an issue there, but I think it's overcomable.
You're focused on questions of design and functionality. At the heart of many of these devices and apps are smartphones, which may have form factors that are too small to be easily used by older people or difficult to read. How much of a concern is that?
It definitely is a concern, although we see with recent form factor changes, such as the iPhone 6 Plus, which has a much larger and vibrant screen, or even the iPad Mini, we're getting the real estate in some of these devices, which is funny, coming out of technology from the late 90s and early 2000s, where everything was shrinking. We could get things as small as we possibly could. I joked around with a colleague the other day. I'd remember those tiny little Nokia cell phones that were related to that Charlie's Angels movie that was just micro cell phones. And now we're going the other direction with bigger screens and more real estate and brighter screens. I think that's a great trend, and it allows people with accessibility issues or physical limitations to be able to see and to be able to touch different elements on the screens. At the same time, too, I think the major manufacturers and software developers are understanding that better design for older folks or even people with disabilities allows for better design for everyone. It's a principle we like to call design for all. And I think the accessibility features that are being built into both the iOS and Android systems, while they can make the phones much more navigatable and usable for folks, the unfortunate fact is that they're still buried in menus that are difficult to get to. So typically you're going to see a user that needs to have these features turned on. They're going to have to rely on someone else to unlock them and set them up for them. But with infrastructure like the Apple stores and the Genius bars, or even adult children, or even grandchildren to help folks along, I think a lot of this is mitigatable, but there's still room for improvement.
I remember having a conversation a few years ago with folks at Intel early in their digital health efforts. One thing I found interesting is that they use anthropologists to observe older people in their own environment using technology. In the case of Project Catalyst, who's doing the monitoring and how?
So we have a relationship with the Georgia Tech Research Institute and their Homelands program, and very similar to Intel's research facility. We're for the first couple studies at least, we're looking to more of an ethnographic research model, whereby these devices will be put into people's homes, and researchers will observe them both from an unboxing standpoint of how do people interact with the packaging and the setup and the instructions, and they'll be taking notes there. And in cases where the end users or the subjects as part of the research study aren't able to navigate the issues that might arise, the facilitators will come in and help them along so that we can get to a point where the device is usable and it's working. And then over a period of time, for this fitness and sleep tracking study, it'll be about 6 weeks, we'll be observing and checking in with these folks to get results of how the device might be working for them or not working for them, modifying their behavior or perhaps not modifying their behavior. And then there'll be an exit interview at the end of the research process where we'll find out would these people purchase these on their own and how likely they were to use them, and where were the pain points along the use curve. Going forward, we'll look to different modalities of research for Project Catalyst. We may have online panels where people can be voting and commenting on product concepts. And we may have more long-term studies for years at end so we can get more longitudinal data. For starting out now, that we're going to stick to that ethnographic model.
Your first study is looking at activity monitors and sleep trackers. Why start with these devices and apps? What was the thinking there?
Well, everyone knows anecdotally that being more active helps not only one may remain healthier, but also can help mental acuity and longevity. At the same time, there seems to be a stigma or a belief that older folks not only are not active, but also aren't interested in tracking their activities. So what we wanted to do is to take 6 or 7 of the best in leading edge devices out in the marketplace and put them into homes and see what really is the effect of these on people's behaviors, but also what are the likelihood of people to adopt and keep on using these. We started sort of, I would say, on the earlier continuum of the healthcare curve to try to see how can we encourage people and how do devices help people maintain wellness to keep them, in some senses, out of the system and out of the traditional healthcare queue. Sleep is an interesting category in that everyone knows it's important, and more studies are showing that it's more important both for healthfulness, but also to prevent dementia and other mental issues. But there's a wide swath of different ways that sleep is being measured and monitored by some of these devices, and there's a lot of concern about standards and accuracy. So we wanted to see, too, how are the 50 plus sleeping, but also in addition to that, would they take the information about the quality and the length of their sleep and then modify their behaviors further?
This is the first of what you expect to be a number of studies. What's the range of applications and issues you hope to look at, and how significant an effort do you expect this to be?
Well, I think it'll be quite an effort, but in a very good way. And good work is work indeed, but still worth doing. We're using a framework from a report that we've put out twice now called the Health Innovation Frontiers report. Again, in association with Parks Associates. And in the initial report, we came up with a framework of 9 areas of health and wealthfulness that we feel really capture what it takes, the different elements of things that it takes for someone to age healthfully and gracefully. And we plan on fielding studies across those 9 areas. About 1 per quarter is the cadence that we're projecting. So these are issues such as vital sign monitoring, care navigation, emergency response and detection, diet and nutrition, and social engagement. We'll be within each of those categories. We'll be looking at particular problem or challenge statements that people are facing as they navigate their healthiness, and then we'll create solution sets and study those, how they either meet and overcome those challenges, or in some cases may fall short, and we'll make suggestions to the marketplace on how things could be designed better.
Jeff Makauka, Director of Thought Leadership for AARP. Jeff, thanks for your time today.
Appreciate it. Thanks so much.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.